Christian Drosten, how much longer do you expect this corona pandemic to go on for still globally?
Well, it's very difficult to make global projections. We have very difficult situations. In countries around here, Europe, the winter will not be an easy one. We will have vaccines during the next year to come. I guess it will last until end of the next year, until significant parts of the population can be provided a vaccine. So there's a significant difference between the first clearance of a vaccine and then the provision of the vaccine to the whole of the population. And so this will determine how the everyday situation for the population will change. So we won't get rid of masks anytime soon. So even while we start vaccinating, the population in largest parts will have to wear masks. In countries like Germany, where incidence is low, there will be nothing like a population-based protection. This is something we probably shouldn't consider for any country in Europe. In other parts of the world, the situation is very difficult to judge. For instance, in Africa, we have signals of lower, let's say, disease presentation, less severe presentation. This may be due to the lower age profile, but we need to consider that what we are looking at now is urban areas on the African continent, where the population composition is particularly young. We don't know what the virus will cause as it spreads to the countryside. We also can't really judge the state of the epidemic. So we have some data that suggests that in, let's say, foci of incidence, there is a slowing down of new cases notified. But we can't say whether this can be generalized in any way. So it is possible that in urban centers, the epidemic is already slowing down, but it's equally well possible that it is still to come.
With all that you know, which regions around the world are causing you the greatest concern at the moment?
Well, India is the current biggest concern. India has a big population density, and the virus is spreading. I wouldn't say in an uncontrolled fashion, but it is almost like this. Then, of course, areas in South America. I already spoke about Africa, so the African continent is a little bit of a mystery at the time being. But also in the northern hemisphere, winter is coming, and there are areas, including in Europe, where there is little control, where countries already go into autumn with a high background incidence, and where the trust in, let's say, the rigidity of the medical structures, but also the power of public health intervention is low. So I believe there are countries, including in Europe, that will have to impose stricter measures very soon.
Which countries are they?
Well, it is difficult for me to name countries in an interview like this.
Many countries around the world have looked at Germany as an example where things went fairly well. What did we do right here?
Well, there is obviously a combination of reasons, like for any complex thing that you describe. But so it's certainly the way the decision making was quite straightforward in the beginning of the first wave, driven by the Chancellery. At that time, we are losing coherence there a little bit, not on that level, but on the level of the federal states, the Länder, where there is some diversity in decision making. But I believe that the decisive point probably was that Germany reacted very early on. So this is not in terms of calendar date, but in terms of the relative point of time when contact restrictions, sometimes called a lockdown, were imposed as compared to the actual development of the epidemic. So we knew about our epidemic based on laboratory testing, and this widespread availability of laboratory testing is something that discriminated Germany from other countries. One reason of this being that we were really fast on the lab level to react. Another explanation, of course, that our epidemic started somewhat later. So our imported cases obviously didn't start to become an epidemic already in January, but this seems to have happened end of February only. It seems that our early imported cases were controlled and didn't result in forward transmission. So this is probably the reason why our intervention was extremely efficient. So after our lockdown, let's say in middle of May, the incidence in Germany was extremely low and has stayed so, well, actually until this day, even though we are seeing a slight increase of notifications now.
Against the background of rising notifications, like you say, what are you expecting for the autumn and the winter here in Germany?
So what I think is that there is actually little difference in population structure and other important parameters between European countries, and we should therefore compare ourselves and look at other countries, look at France, the UK, Spain. What we're seeing there is what we will see in Germany if we don't react very early on in a way that needs to be adjusted, that needs to be, let's say, bearable for the economy and at the same time targeted. And this is a very difficult task, to find the right point of time when to somehow modify the intervention measures that are in place now, because we have good intervention measures in place, and at the current level of incidence, there is nothing to criticize there. So these measures to control the epidemic are quite efficient, maybe slightly more efficient than in some other European countries, but I wouldn't say that Germany stands out there. And the big challenge is actually to recognize the turning point. So the point when in certain compartments in society, incidence has increased to a level that the incidence, the virus is widely spread in other parts of society. And this is very difficult to estimate now in autumn. It was easier in spring, where actually the transmission chain started from importation events. Now the virus is distributed in a different way. It is distributed in population compartments that are not as easy to reach on the one hand. On the other hand, it has spread under the cover of, let's say, low willingness to test. So the young people, when they get infected, they are reluctant to get tested, obviously, because they have mild symptoms in general. And of course, sometimes the way they acquired their infection is based on parties and other social activities that shouldn't have happened. So this is actually the biggest challenge in the weeks to come, and then the challenge to communicate right, because we will see an increase in incidence as in other countries of Europe. And as we are testing much more than in springtime, the value of the number of detected cases has changed. So we expect more cases now. And what the notification shows is just a representation of what happens in reality. And this representation is different. The picture that we are seeing now is a bigger picture than the picture we saw in spring, while the actual numbers may be the same.
You've previously mentioned rapid antigen tests as a measure to help improve contact tracing. What other measures can you think of that would help Germany prevent a situation where the health system would be overwhelmed?
Well, first of all, I'm not sure whether, let's say, rapid and simple antigen tests improve tracing. They will probably be able to inform decisions in the details, in the tiny structures of decision making, like public health agencies who can use these tests, but maybe also other parts in society. For instance, let's say if you have events and you clear these tests for entry screening of participants of certain events, that would make a big change. But this is a regulatory and political question. It seems that the technical quality of these assays is much better than what we were used to looking at similar assays for other infectious diseases. So it seems that this at least is a good message in the current situation. You are asking for other measures, other interventions. It's wearing masks. There is clear scientific proof. So in contrast to spring, where actually we had used old scientific proof not based on coronavirus outbreaks in particular, we had to say there is low evidence for the use of masks. Now this has changed based on the very case of this virus and this pandemic. There is now evidence for the effectivity of mask use. Then, of course, it seems there is independent support for hand hygiene. There is independent support for keeping distance. Another very important intervention is to speak to the public. So everybody has to know about the basic principles of transmission of this virus. It is not sufficient to impose rules that people don't understand. So the cooperation of the population, especially in the coming weeks and months over autumn and winter, is probably one of the most important functions in the whole concept to intervene. And then we are hoping for a vaccine. We have to hope for a vaccine. There is no other way out of the situation. So the acquisition of population immunity is very likely to go along with an intolerable number of fatalities and severe courses of disease. So the virus, if we let it run, will force a lockdown. This is completely inevitable if we do not intervene. And we do intervene. Everybody has to understand the intervention, but this intervention is bearable only for a limited amount of time. So we need a vaccine certainly during the next year to come.
You've already said that we will have to live with masks for a long time to come still, even with a vaccine in place. So when will we be able to hug each other again? Grandparents, but also strangers?
This will be a very regional question. So in parts of the world, I wouldn't be surprised to see population protection during the next year to come. But this means they will have undergone an epidemic that may not appear as such a severe epidemic based on their age structure. So we already spoke about Africa, where this could happen. At least this is what I wish, that African populations are protected because of their younger age profile. That would be a very good expectation. In other parts of the world where the concept is to avoid widespread virus transmission, to wait for deployment of a vaccine, we can expect to wear masks until end of 21. I would expect. It's impossible to make exact projections, but the next year will be a year in which we wear masks.
And on a more personal note, why did you decide to accept this award? Why did you decide to give me this interview? Do you feel that there's a need to raise awareness again?
Yeah, I certainly feel that the explaining of these complicated problems to the public as wide as possible, and then the repetition and the explaining again. It is an intervention per se. It is a non-pharmaceutical intervention, probably the most important one, because it's the considerations that you make day to day, the decisions you make day to day, whether you will have this party and how many people you invite. This is a day-to-day decision for normal people. It's nothing that politicians or public health agencies can really direct.
Thank you very much, Christian Drosten.